I think first, just to clarify that I actually work for an organization called BSR, which is Business for Social Responsibility, and we work on global labor conditions and issues related to environmental sustainability as well in factories all over the world. So that's something that our organization is tackling. Her project is an initiative of BSR that we founded about 6 years ago that's really focused on the personal health of female workers and working with them on, very specific health issues such as reproductive health, nutrition, menstrual hygiene, HIV, and malaria. So we, just to sort of make that distinction, and I think when we look at the factory conditions and some of those issues and the recent tragedy in Bangladesh, I think what that tells us is that there's so much more work to be done in ensuring that factories are safe and that the conditions are as risk-free as possible. And of course that relates to health because a lot of people either died or have now had injuries that will plague them for the rest of their lives and prevent them from participating in the economy in the way that they were before. So I think first and foremost, we have to do more, and the we there is a lot bigger than global companies. It's Bangladeshi companies, it's the Bangladeshi government, it's Bangladeshi civil society, it's global organized labor, and it's Bangladeshi organized labor. So I think there's a lot that needs to be done there. In terms of our program and the work that we do, I think there's 2-3 million other workers in the Bangladeshi economy and in the garment industry, and 70 to 80% of them are women, and they are going to continue to take those jobs. They're going to continue to have health needs, and so these two efforts have to go on in parallel. We have to keep working with them, educating them, empowering them to make better choices for themselves, and we also have to work as a collective to make those jobs better. Well, I would be remiss not to mention my own first, but her project is probably the largest global program that's working in collaboration with the private sector and local NGOs to further women's health and to promote it in the workplace. So we're working with 22 multinational companies from Europe and the United States to integrate women's health into workplace programming. And there are other examples of company-led efforts. So Walmart and Gap both have large women's empowerment platforms that have women's health as a component of them. I think there are programs in Africa in particular where there are some companies that are integrating some women's health issues into their HIV programs, but I think not enough, and I can't even name one. I know I've heard that it's happening, but there's no one company that is sort of becoming a leader on that issue. So I think the fact is women are filling these jobs, and if you start looking at your female workforce as having unique needs to your male workforce, which is sort of a fundamental basic thing to do, then you're going to see that women's health is a critical component of your business and of your human resources management. And so I think right now, fundamentally, we have a measurement and a management issue, which is that most workplaces that I go into and most workplaces I think around the world are not looking at their workforce as gender disaggregated, and they're not looking at any of their human resources data in a gender disaggregated manner. So they don't really understand the value of women's health fully yet. Well, I mean, I think those issues are controversial in the United States in certain ways. They're controversial in highly conservative countries around the world, but organizations and like FHI and CARE and Gender Health and likewise Pathfinder and likewise government agencies like USAID, Swedish SIDA, and the Dutch Foreign Ministry, both of whom fund our project, they have found ways to introduce family planning and reproductive health into the most conservative communities in the world. So these are not impossible objectives, and frankly, they're not controversial. Much more controversial than making sure that your female workforce has some information about how to care for their body and how to plan their own family. Much more controversial than that is, back street abortions leading to workers dying, or women leaving babies, abandoning babies in garbage cans. And both of those things happen in China all the time, and nobody talks about it yet, but they might sometime. And so that to me is much more controversial, that those things are happening, than the idea of providing some basic education to help women make better choices for themselves. So I think there's, my fellow panelist, David Wofford, in the session that we were on today, made some really great points about the different types of ROI, the financial return, the sunk cost savings, and then there's sort of an opportunity ROI space too. And so I think that's a really good way to look at it. The other frame that we put on it is, that there are factories and farms who are employing the women, and they have certain very clear ROI that come from reduced health-related absenteeism, reduced turnover due to improved employee satisfaction, and a sense that management cares about their employees. And so when turnover is reduced, there's savings in terms of new worker recruitment, in terms of the productivity loss of a new employee. So there's huge savings related to that. We also see improved quality. So, a lot of the women that we work with face issues such as anemia or tuberculosis, as Zafar talked about on our panel. And those types of issues cause weakness and, slowness. Your mind might be slowed down by some of those issues, and so you're obviously going to not work as well. And when you're talking about a garment factory that's all detail-oriented, you're going to have more mistakes, and you're going to produce slower. So as you start to address some of those health issues that are chronic and that affect every moment of every day for people that suffer from them, then you're going to see improved quality, and you're going to have cost savings there, and you're going to see higher productivity. But then there's also, the brand, the multinational company lens. So they're purchasing those goods from the factory, and so they see benefits as well. They see benefits. I mean, if their products have higher quality and they can produce more in a shorter period of time, then the multinational company benefits from that as well. But they also benefit from improved compliance practices of factories that participate in programs like Her Project. I mean, we see a huge gap in terms of the human resources management skills of a lot of the factories that we work with. And as they start to work through the year-long process of Her Project and many other similar workforce empowerment programs like the ones I mentioned that Gap and Walmart run, Levi Strauss runs many other companies do as well. And over that course of that time, they're going to start improving their human resources management, and that's going to make them better employers. And that's going to help buyers limit their risk in terms of buying products from those factories if they know that they are managing their workforce more effectively and more ethically.